The most common neurologic disorders are movement disorders. Movement disorders are more prevalent in older people. With our aging population, it means that these diseases become more and more prevalent, affecting more and more people every single year. For instance, here in Europe, 80% of people with Parkinson's are over the age of 65. There are quite a few symptoms that are experienced by people with Parkinson's disease and with essential tremor. For instance, someone with Parkinson's disease can have very bad tremor. But on the other hand, they can experience stiffness or slowness. People with a neurologic disease often complain of very high impact on their life. The patients have more and more symptoms over the years. And people who responded well to medication in the beginning may not respond to medication anymore. And that is when we suggest to do deep brain stimulation.
With deep brain stimulation, the surgeon implants a stimulator, a pacemaker, in the chest or in the abdomen. And this stimulator is then connected right in the brain. Let's take one symptom, tremor. If you have a patient with tremor and a DBS system in place, if we then add electrical current through that system, the tremor will gradually fade away.
When we do DBS, the goal is to have a better symptom control. So for instance, less tremor, less rigidity, less slowness of the movement. But as a second advantage, often we can reduce the medication quite a bit, because often the medication can have a downside or a negative effect as well.
But the stimulation at the moment is not selective. So we can have a therapeutic effect, but because that stimulation spreads out, the patient can also experience side effects. DBS is a good option, but it's not perfect at the moment. In DBS SELECT, we are actually developing two different ways to have more selective stimulation. What this means is that we're able to deliver a better therapeutic effect without causing side effects. The uptake of DBS is not at the best level. One way to improve that is actually to teach patients, their families, healthcare professionals about the potential benefits of the DBS SELECT.
When I talk to my patient about deep brain stimulation, often they're quite daunted by the surgery. But when we invite them and take them on the guided tour here at Health House, they're very happy and often very relieved. They see that it's actually a very gentle surgery, that it's done with the highest care, and it's very reassuring for the patients.
The funding and support from EIT Health has been really important. Without financial input and support from EIT Health, we would not have been able to build the DBS education platform. We also wouldn't have been able to complete the patient clinical trials that are ongoing. Ultimately, we would like to roll out this technology to all patients across Europe, and so they can benefit from improved DBS therapy. We believe that this will help individual patients to improve their quality of life, but we think it will also bring larger benefits to society.